Hello, my name is Dr. Roshni Medisani. I'm a cosmetic dentist at Capital Dental Care. We are located on Botanical Garden Road near Barfigar Sweet Shop, opposite Chirek, above SBI Bank. Today's topic is the do's and don'ts after you get your tooth removed. First, I'm going to be talking about what you should do. The first thing you should do is make sure that you bite on the gauze or cotton that your doctor has placed. Make sure that you bite on this for at least 30 minutes. This helps ensure that your blood clots and there's not excessive oozing. Another thing that you should do is make sure you take the medications as prescribed by your doctor. Whether they have given you antibiotics, painkillers, or just one of these, make sure you take them as advised by your dentist. Another thing we advise is to get a good amount of rest. It's advised that you do not do any strenuous activity, weightlifting, go to the gym, or do any yoga poses where you're bending your head down. Your body requires a good amount of time to heal after the surgery. When it comes to what you should eat, then we suggest that you have cold, soft, and nutritious food. Make sure that you are eating because your body does require nutrients to heal properly. After 24 hours, we may also advise that you do saltwater rinses or rinses with a prescribed mouthwash. Make sure that you're doing it gently. You can follow this for about 10 days after the procedure. Sometimes you may be also advised to do certain mouth opening exercises. You can start doing these after 24 hours. This will ensure that you do not have any muscle stiffness or any fibrosis, which will restrict your mouth opening as your tissue heals. Another thing that you can do is use an ice compression. We suggest that you do these for the first 5 days after the surgery. Ensures that it reduces the swelling and there's not too much of inflammation. We definitely do not suggest that you put an ice directly on your skin because this can cause a burn. Make sure that you're using either cold packs or you're at least wrapping the ice in a cloth. You can put the ice for 15 seconds on and 15 seconds off. You can do this multiple times in a day. After about a week, we suggest that you use a warm compression, following the same concept of 15 seconds on and 15 seconds off. This ensures there's a good amount of blood flow which will clear the area and also help promote healing. Now, when it comes to what you should not do, make sure that you do not spit forcefully. Do not gargle forcefully, do not cough or sneeze because this can cause a dislodgement of the clot that is forming and delay your healing. We also definitely do not suggest that you use straws. Straws create a negative pressure in your oral cavity which can also dislodge the clot. We advise that you do not smoke for at least up to 1 week after the surgery. This is because the heat and the pressure from smoking can in fact delay healing and cause more damage and may also lead to something called a dry socket. Do not consume alcohol for about a week for as long as you are using medication. This is because the alcohol may harmfully combine with the medicine and cause various effects. Also make sure that you do not touch the area where you've gotten the surgery with your finger, with the straw, putting a toothpick, etc. This can in fact irritate the area and not allow it to heal properly. It may also lead to an infection if you're unnecessarily touching it. When it comes to a diet, make sure that you are not having anything which is hot, spicy or hard. All of these can in fact irritate the area and in fact lead to more inflammation. When it comes to certain general things that you should follow, when it comes to brushing, make sure that you do not brush for up to 8 hours after the procedure. After that, you can gently brush the rest of your teeth. Do not brush near that area where you've gotten the surgery for at least about 5 days. Pain is something that is commonly expected after you get your tooth removed. This pain is usually mild and it will subside within a few days. Also, you can use the painkillers as advised by your doctor to help reduce this. Often people also may have a swelling in that area. This is quite common, it's nothing to worry about. The ice compression will help reduce it and eventually the warm compression will also help. The swelling usually increases during the first 3 to 5 days and after that will gradually subside. Make sure that you are not sleeping on that side where you've gotten the surgery because this will also help reduce the swelling. You will be given a local anesthesia during your procedure. This numbness from the local anesthesia lasts for about 1 to 4 hours. During this time, make sure that you do not accidentally bite your lip or cheek. Make sure that you are taking care. The numbness should wear off within 1 to 4 hours, and if it doesn't, if it's prolonged, or if you feel any tingling sensation along the area that's been numbed, then please make sure that you do consult your doctor. If stitches have been placed in that area where you've gotten a surgery, then know that sometimes as your tissue heals, these stitches may slightly loosen, which is completely fine. Do not touch the stitches with your tongue, your finger, etc. It can further infect it and cause damage to it. If it is a non-resorbable suture, then after about a week or two, your doctor will remove it at the clinic. This is how, if you get your tooth removed, then you should follow certain do's and don'ts to ensure that it heals completely properly. If you do have any other questions regarding your teeth, gums or your oral health, please do leave them below in the comment section and we will reply to them. If you'd like to know more about this or any other topic, then please make sure that you like, share and subscribe our channel.